Well, hello and welcome to Rajat TV. You're watching India Fights Back with your host, Rajat Kain. Well, in this episode, we'll discuss everything that's possible about a new mutant. This is a show that talks about how India, or to say world, is fighting the COVID-19 pandemic. Now, as we have seen a gradual decline in numbers, especially to say in India and several other countries, there is a new fear, or at least something which authorities are gaining cognizance about, and that is new mutant. Of course, we know the property of virus is to mutate, and every time there is a virus, there are mutations as well over the period of time. But here, as we saw in UK and now in South Africa, there is a new mutant which has been studied by the authorities for its transmission and of course for severity. Talking of a mutant virus in UK, the jury is still out whether it's more severe than the existing COVID. It's fairly certain that the transmission rate happens to be far greater, at least 70%, than the existing COVID. So how far we need to study these new mutations, what exactly is mutations of virus and what are the precautions to be taken? For more on that, we're joined with three important panel of guests. We're joined with Dr. N.K. Ganguly, who is former Director ICMR, Dr. Rakesh Aggarwal, Director JIPMER, Puducherry, and Dr. Suneela Garg, Head of Department Community Medicine from Maulana Azad Medical College or MAMC of New Delhi. Well, many thanks for joining us. This is indeed a very important discussion. Let me start with you, Dr. Rakesh Aggarwal. So, as a medical expert, as a virologist, could you explain the phenomenon of the virus, whether mutations are fairly common to virus? I mean, let's for a moment keep aside COVID-19, but let's study or talk about virus per se.
So, a virus is nothing but a code of nucleic acid, DNA or RNA. If we take RNA viruses, so it's a bit like, children take these beads of 4 different colors and they can make very different, necklace out of it. Mm-hmm. So let us even if we take at COVID-19, it's a virus which has a nucleic acid which has 30,000 beads in a way. And these beads are say of 4 colors or 4 types, C, G, A and U.
Right.
You can combine them in a large manner, in a large number of possible ways. Mm-hmm. So we know roughly there are 9,000 A's, 9,000 U's, about 6,000 C's and 6,000 G's. Right. And it's a particular sequence that we identify as a particular virus.
Right.
Now ask 1 million children to make copies of these. When they make copies of these, they will introduce small errors here and there. And that is what we call as variants, mutants, strains, whatever you wish to call it. Some changes are minor and they don't seem to matter. But if one copy is taken somewhere else and now people make more copies of it, it is possible that those copies will far exceed the actual original that we had, and that then becomes a new strain. Now, some changes keep happening. Just like if we were to ask some children to copy a necklace with 4 different colors of beads, which is a long necklace, some mistakes will happen. They all the time happen. Some viruses, they are more common. For instance, something called viruses that are made of RNA. The proofreading is poor and they are more common. With DNA viruses, they are less common. So it varies, but it is an extremely common phenomenon in real life. The problem comes when a particular variation or a particular different style that you have now got, if it starts getting copied much faster rate, so if one particular variation is taken up by a factory and they mass produce a large number, so that this number will now far exceed what was being made in the home industry, then there is a problem. And again, it doesn't make a difference if it doesn't cost more, if it looks as beautiful. But if it costs more, if it looks more beautiful, less beautiful, or sometimes, for instance, I believe there was a time when a foreign company tried to copy our Ganesh except that they copied the nose, went in the opposite direction, and they couldn't sell it. Okay, so that kind of a variation makes a difference. Otherwise, variations are extremely common.
Well, that's right, Dr. Aggarwal, and many thanks for your opening remarks. Let me go off to Dr. Garg, Dr. Suneela Garg from MAMC. Ma'am, here, like as Dr. Aggarwal explained about the nomenclature of the virus. Now, I know it's still early days and we are still trying to understand this new variant. So how far do you think and what are precautions that needs to be taken for this particular mutant?
Yeah, basically, you see, as soon as you see this variant is detected and it is brought to the notice of our authorities, now we have to be immediately cautious as to, you see, where the variant is. Like it has been detected first in South Africa and then in the eastern part of the London, then in main London itself. So we have to look at, how many passengers are coming to us, and we need to be very careful as to how much we can restrict the import of this virus. So that's where, from 23rd November onwards, still from 25th November onwards, till of 23rd December, we have started looking at all the passengers, their travel history, and then we have divided them into two parts. One is from 25th November to 8th of December, and then from 8th of December onwards till 23rd of December, because from then onwards we have stopped the flights. So from each passenger, we are asking for their history of travel, and then we are asking for, their symptoms and all that. But not only that, we have to also be very cautious that most of them have also gone to their homes, you see. So we need to look at exactly what are the community contacts as well. So this becomes very important part of our standard operating procedures, that we need to look at every passenger, whosoever has traveled, their co-passengers who are 3 seats in front, 3 rows in front, 3 rows behind, and who are in the same line. So we have to look at each one of them very carefully. And then simultaneously, we are doing RT-PCR at the airports, and then, the samples are being sent to NCDC and forward to NIV Pune. So that is how we are closely watching at these people, because we are particularly vigilant at this point of time when India is seeing a strong, a much larger decline in terms of number of cases as well as in terms of deaths. So we have to be very, very careful, and we have to see that it has got larger repercussions also, because when we are, on the lookout for the vaccines which are going to come very soon to us. So these are some of the important things. You see, in my initial part, I will like to say, so these are the SOPs which have been taken into consideration immediately.
Right. Many thanks, ma'am, for your opening remarks. Let me go off to Dr. N.K. Ganguly, who is former Director General of ICMR. Sir, many thanks for joining us. So here I have a very simple question. Now, as we know, the Government of India has issued new SOPs vis-a-vis the new mutant that has been discovered of COVID-19. Now, given the size and density of a population, and of course, there is, as we speak, there are reports of a new mutant from South Africa. So we know that the virus mutates, but what more precautions should be preempt in terms of our size and density?
Actually, if this mutant comes to our country, it will be a disaster, because this particular mutant has got 23 mutations. One single virus has got 23 mutations, two major mutations in the spike protein, which makes it very, very transmissible.
Okay.
This particular thing will actually choke our hospitals, because it has choked the Britain's hospital and the health system. And it is futile to say it is not more virulent above 60 to age and above. It is mortality is 18% and more. It is very highly virulent, and there are long-term effects also. So the transmissibility becomes very, very crucial, and that is why we need to enhance our surveillance. And surveillance at the moment, 6 different centers are doing sequencing in our country very effectively. This data should be shared. This data should be compared, and we need to detect if it has entered our country already, because it it started in September. So there are about 4 months which have happened. It might have already gone. So we need to be our surveillance, as well as we need to create a test. We have to tweak the RT-PCR by creating a test which will quickly detect it at the airports. That is a possibility, because we have the sequence. We can create a new primer. It will not be a standardized test, but we can do this particular test. Finally, I will say that there is one hope that Regeneron antibodies can neutralize it. So at the moment, current antibodies can neutralize it. So current vaccines will also be able to neutralize it. South African strain, we do not know that much about South African strain. We know the mutations which have happened, but only 2 or 3 cases first entered UK. So they were studying it. 2 more studies are on, and we are very keenly expecting those studies results. One result is this: because vaccination is already on in UK, we are going to wait that whether the current vaccinations will neutralize it as effectively as possible. There is another set of studies which are ongoing in the hospitals to know that if, because of this mutation, some major organs are being targeted more or not. So these are some studies which are on, and maybe in another 15, 20 days, 30 days, we will know a little more about this virus. But if this virus enters our country, it will be a disaster which is in the making. So we have to enhance our surveillance very, very strongly.
Right.
One more surveillance which we need to do apart from human is the sewage surveillance. Bangladesh and many other countries have done the sewage surveillance, and they are very good indicators of what's happening in the nature.
Right. Professor Ganguly, I'll surely come back to you on the mechanism of surveillance here vis-a-vis this virus. Professor Aggarwal, in Professor Ganguly's opinion, this virus happens to be fairly virulent, severe if we compare with the existing virus. So now, I know, there is no proof about the severity of it so far as the data has been analyzed, but theoretically, does the transmission rate has any proportionality with the severity of any infection or a virus to say of?
That's a very interesting question, and a very important one at that. The ability to transmit has no relationship whatsoever across viruses to severity of disease. Common cold, it's extremely transmissible.
Yes.
One person in the family gets it, virtually everybody gets it. Most of those viruses have a very high transmissibility, but they are very mild. Look at any other infection, viral conjunctivitis. One person gets it, 3 people get it. It's not a severe disease. For that matter, severity of disease varies from person to person also. And to the best of my understanding, transmissibility and severity are totally different aspects of a virus. So, one could be, the basic point right now is our anxiety. We do not know, the fear of the unknown. Variants are common. The 23 variations that are present in this variant, many of those variations individually or as a group of 2 or 3 have been observed in many isolates from around the world. It is just that these are happening together. The question is, and that will happen, we are comparing it to what was isolated at the beginning. As we make more and more copies, the number of errors will increase, and those that will happen. The other thing that we need to keep in mind is, we really do not know what it means. So, as I said, if one child makes an error while copying the necklace in the sequence of beads, and then that is mass produced, suddenly it goes into a city where there are not large number of people making copies, you would seem to feel that suddenly this is, has a faster rate of multiplication. But it might just be that it happened in a particular area. I wouldn't say that there are no data. There are some data that this is this is more transmissible, but that should not make us feel that, necessarily it would also cause more severe disease or a higher mortality. The same way, we cannot say that it necessarily will be, more resistant to the vaccine. So what happens in the vaccine, these virus produces a protein. If I were to draw it like this, let's say. Now, if a amino acid changes, let's say this changes. Now, when the body develops antibodies against this part, those will be those will not be able to bind here. But when we give a vaccine, a body develops antibodies against this part of the protein, this part of the protein, this part of the protein, multiple parts. So even if a part changes, very likely that antibodies directed against other part of the protein will continue to act. Of course, over years, as more mutations accumulate, there could be a point when the vaccine does not work as well.
Okay.
But we have mRNA vaccines, we even have protein vaccines. For mRNA vaccine to change and incorporate this change into the mRNA vaccine, it will take a few weeks to months, but it should be possible. So really, I think science has allowed us the tools to detect these variants much earlier. If we were 10 years ago, we would never have realized that there was a variation,
Yes,
but it has also given us the tools to deal with it. I think the more important thing right now is the fear of the unknown. Let's just wait. Let's not be, as if we are sitting on fire. Just wait for a few days. We take our precautions, and those precautions are simple: mask, hygiene, distancing, and if we continue to do that, we keep the transmissibility low. Even if it has come into the country, we have to make sure that it doesn't transmit widely. The basic thing that again everything reinforces is we stick to our basic ground rules: mask, distancing, hygiene.
Absolutely. So COVID appropriate behavior is extremely essential here. And that also leads to another question to say of Dr. Garg. Again, since we are just discussing this virus mutant, which happens to be in the early days, and a lot of research is going on this. Dr. Garg, let me ask you this. Suppose there is a person who has just recovered from COVID and has developed antibodies towards the existing COVID. So now, is he or she, or the recovered person, is also susceptible towards the new variant or new mutant to say of? Or
Yeah, that person is fairly protected against the new variant of virus. And let's say if, right now, as we were talking of the transmissibility, and we are also talking about the fact that this is a less severe this thing. So obviously in this person, the manifestations will not be there. So that is where the chances of, he may carry the infection, but it will not be manifesting in that manner. So that it is important to look at from that perspective, because already the antibodies would be there to take care of that newer mutant virus. So we have to be assured about that part. But again, you see, when we are talking about the persons who have suffered also, and as has been mentioned, that COVID appropriate behavior has to be followed on. Even if you just suffered from the infection, so that itself will also take care of the newer mutant virus. But as far as you see, my knowledge goes that this is not going to manifest in that person, the newer strain of virus who has already been just infected and is recovered.
Well, that's very important point, ma'am. Many thanks. As we move towards the closing of the show, Dr. Ganguly, let's in very brief, you were just talking about the surveillance strategy and the SOPs. So, in terms of the precautions and surveillance, what else would you suggest the authorities should be cognizant of?
Actually, surveillance is the bedrock of prevention. Because that is where you first detect whether something new is coming up and whether it is building up and transmitting itself heavily or not. So the surveillance also is done in the animals, bats and other animals, and because it is very, very necessary, apart from doing in the humans. So human surveillance are two varieties. One is the molecular surveillance of virus, where sequencing is done. Other is antibody-based surveillance.
Well, I'm afraid we have just lost our connection with Professor Ganguly. Professor Aggarwal, if you are with us, sir, yes, if we talk further about the surveillance and, of course, the precautionary measures, besides COVID-appropriate behavior, what else would you suggest should be required for this new variant of virus?
I think the basic points remain the same. We just need to, reinforce each of those messages again, and maybe we need to do those with a greater vigor. In addition, of course, we need to be on the lookout for the new isolates, which labs in the country are already started to do. And finally, I think we need to keep our ears and eyes open to learn new information. I'm sure in the next few days we will have a lot of new information coming.
Absolutely.
The studies on these issues are already happening around the country, and we would soon know, not the country, around the world, and we will soon know whether this virus, this new variant, is more severe disease, whether we need to do anything specific. But till then, I think we persist with our basic same measures.
Right. Many thanks. Yes, ma'am. Please, ma'am. Yeah. Please go ahead.
Another thing I'll like to add is that already, the surveillance guidelines have been issued for the state government.
Absolutely.
And also by NCDC under Integrated Disease Surveillance Project. So primarily, we need to look at, the contacts of the passengers, and those who have tested positive should be in isolation. That is there. And their contacts who have tested negative should be in quarantine for a period of at least 14 days. So we need to, and whosoever is the contact, you see, the people who have traveled earlier, around, let's say, 25th of November, we need to look at the community contacts also, and daily calls are being made to those persons as to whether any symptoms have come in them or not. So this is how you see our IDSP mechanism is also very much, kind of activated now to follow each and every passenger in depth, so that we can isolate persons who are positive at the earliest and follow their contacts and isolate them or put them in quarantine, so that we can see for emergence of any symptom. And at the same time, as has been pointed out repeatedly, we must stress upon SMS, that is sanitizing, masking and social distance.
Right. Ma'am, I have just like 30 seconds, and I can squeeze in a very small question for you, Dr. Garg. Any particular age group you would say would be vulnerable or seems to be more vulnerable to this new entrant, if we talk of India? Very shortly.
We say that with the new mutant virus, it is the children who could be more vulnerable. So we have to be more attentive towards children as well. So, but then otherwise, we have to be overall, taking actions for everyone. The elderlies have already been there, but then earlier we were much positive for the children that they are safer, but now we have to be much more cautious about children as well.
Well, many thanks, Dr. Garg. Many thanks, Dr. Rakesh Aggarwal. And of course, many thanks, Professor N.K. Ganguly, who was with us. And just there was some connectivity issue, but many thanks to all the panelists for elucidating this extremely important issue of a new mutant of COVID and how well we should be cognizant of it, what are precautions we have to take. Well, before we leave, a very small appeal by RSTV to all our viewers. Please maintain the COVID-specific behavior, keep wearing face masks, keep washing hands, and do not forget to maintain the physical distancing. Well, these are small things that can help us in defeating the pandemic. Well, that's it in this edition of COVID-19 India Fights Back. Keep watching RSTV for more. Thank you. Goodbye.